Hey, this is Anastasia with Hump Day Happenings. Question this week was, is the HPV vaccine able to prevent your chance for oral cancer? No, unless you're living in a monastery and sexually inactive. You might have a chance with that. Here's the deal with HPV vaccine and its relation to oral cancer. HPV is the human papillomavirus virus. It is an STD, which is a sexually transmitted disease. How do you get it in relation to oral cancer? Oral sex. Oral sex and oral cancer, they are related. Just because you can't get pregnant from it does not mean you can't get something from it. HPV related. So, let's talk about vaccines. There's two of them out there, Gardasil and Cervarix. They're targeting women and men now, but more so on the women's side because the strains of HPV, which are over 100, a few of them in the high-risk category are associated with cervical cancer, anal cancer, genital warts, and of course, oral cancer. Now, the vaccines are in a series of 3 injections over 6 months. The ages that they're targeting are 9 to 25. Although they say you could get it up to the age of 45, however, you have to be sexually inactive and also have no pre-existing condition such as a strain of the high-risk HPV. Okay, having said that, side effects are fainting, head injury, blood clot, stroke, death. Oh yes, maybe a little swelling at the injection site. This is invasive. They have no idea how long the duration is in your body. They're estimating 4 years, but they're not quite sure. They also are estimating that you might need a booster shot for the HPV. Now, if you're looking for a screening that's non-invasive and you want to know if you have HPV, let me share the statistic with you. 80% of Americans have had or have one strain of a high-risk HPV by the time they are age 50. And the more partners that you have, which is estimated at over 5 partners, the increased risk that you have of having HPV. Final stat, 35% of oral cancers are HPV related. It's going to put a whole new spin on love the one you're with, right? So ask your dental professional. We have got some great screenings. The newest one unveiled this year, 2010, was oral risk HPV. You rinse with a saline solution, you spit into a funnel-like test tube, we ship it off to a lab, and you will know, do you have a high risk of HPV? Other questions your dental professional is going to ask you. Do you smoke? Do you drink alcohol, and how often? Is there a family risk or family history of oral cancer? And finally, do you know the signs and symptoms? You got anything red, white, ulcerated in your mouth? Any lumps or bumps? You got any difficulty swallowing? Soreness in your throat? Hoarseness in your voice? Tell your dental professionals these symptoms. It's all about prevention. I hope this helps you out. You know what to do. Go to humpdayhappenings.com. Ask me an oral health related question, and until next Wednesday, take what you learn, make a difference with it.